So now you know what it is. Okay, now you know what it is. What is it going to look like? Or you know what's happening in the esophagus and in the body. What is it going to look like on the outside? Or what is your patient going to complain of? Right? Your assessment. What are you assessing? What are you looking for? Okay, pyrosis. This is that burning sensation. Okay, that burning sensation as it radiates upward, generally after eating. Okay, that's what your patient is going to tell you. It burns. Okay, that is that pyrosis. All right, regurgitation. Okay, regurgitation is the feeling of it coming up. Okay, sometimes it'll give a sour taste in the mouth. Okay, other symptoms: dysphagia. Okay, dry coughs, hoarseness, sore throat. Again, because it's coming upward. Okay, it's making all of this sore. It's acidic. All right, it can even cause some flatulence. All right, coughs, wheezing. All right, that's what it's going to look like. Okay, that's what your patient is going to look like. Some diagnostic testing. Okay, a pH test, testing the pH. Okay, a small NG, inserting that small NG tube. Again, if you didn't watch that video, go back and watch that video about the diagnostic testing. Okay, they're going to test out the pH to see if it is more acidic than it should be. All right, they may test or do a esophageal motility test to see the peristalsis. Is the peristalsis that wave-like motion? Is it moving correctly? Is it slow? Is it too fast? Okay. The barium swallow that I also mentioned in that video, they will also do something like that, okay, to see how everything is going when it is being swallowed. Okay. Medical management: avoid problem foods. Okay, so your patient will most likely have to keep some sort of diary so we can try to see, okay, what are your triggers here? What are you eating? After you ate hot Cheetos and now you're having reflux, okay? Could it be that? Could it be the hot Cheetos? Do we need to ex-nay the hot Cheetos out your diet, right? Stop smoking, okay? If your patient is a smoker, you want to educate them to end that, right? Elevate the head of the bed, okay? Lose weight. Prompt them to lose weight, okay? Certain medications, antacids to neutralize the acid, okay? An H2 receptor, a PPI, okay? Some sucralfate, okay? Reglan. Reglan is a pro-motility agent, but it can also help with nausea, vomiting if they have those symptoms, okay? Nursing interventions as far as like dietary instructions. 4 to 6 small meals. Okay, small meals, low-fat meals with an adequate amount of protein. Okay, reduce intake of like chocolate, tea, anything with caffeine, caffeinated beverages. No alcohol. Okay, no alcohol. I feel like alcohol and smoking is always one that you want to cut out. Okay, it's bad for the body. Limit or sorry, I already said alcohol. Eat slowly, chewing thoroughly. Okay, avoid anything, any foods or anything in the evening, especially 2 to 3 hours before bedtime. Don't eat then. Okay, remain upright for at least 1 to 2 hours after eating. Okay, and never eat in the bed. Never eat in the bed. Tell them, do not eat in the bed. Avoid foods that produce the heartburn. Okay, and then reduce the body weight. I already said that. Reduce the body weight if needed, if that is one of the risk factors, okay, that's causing the GERD, okay. Lifestyle changes. You also want to take effect to how this might affect like the whole person, okay. We treat holistically, like, right, the whole person. So how is this going to affect them psychologically, okay? We as nurses do need to take that into account. It may be an adjustment for them to make certain lifestyle changes, to stop smoking, to change like the clothing that they wear. Maybe they wear tight clothes, okay? Because that's another thing that they may have to stop, okay? If they have GERD, it's compressing, it's pushing to make the food and the acid or whatever go up, okay? So avoiding tight clothes. Avoid certain straining activities, heavy lifting, okay? Never sleep flat. Okay, these are all adjustments that will have to be made. Okay, and that's pretty much it about GERD.